Evening, and I hope everybody is well in our Facebook community this evening. I want to welcome you to the SECURE-IBD Registry, tracking global IBD COVID-19 cases, medications, and more. I'm Laura Wingate. I'm our Senior Vice President of Education, Support, and Advocacy for the Crohn's and Colitis Foundation. And it's my pleasure to introduce our presenters for this evening. I'd like to first start by introducing Dr. Erica Brenner, pediatric gastroenterologist at the University of North Carolina School of Medicine, and the co-PI for the SECURE-IBD Registry. Welcome, Dr. Brenner.
Thank you for having me.
We're thrilled to have you. And Dr. Kappelman is the next person on the screen I'd like to introduce. Dr. Kappelman is the Associate Professor at the University of North Carolina School of Medicine and a co-PI for the SECURE-IBD Registry. Thank you for being here, Dr. Kappelman.
Thank you. It's my honor.
Well, I'd like to jump into the questions so we can really share everything that's going on with the SECURE-IBD Registry. And Dr. Brenner, I'd like to start with the first question on what is the SECURE-IBD Registry? What is its purpose?
So the SECURE-IBD Registry is a project that myself and Mike from the University of North Carolina, in collaboration with Jean-Fred Colombel and Ryan Ungaro from the Icahn School of Medicine at Mount Sinai, have developed. And next slide, please. And the purpose of the registry is to rapidly define the impact of, oh, did we lose the slides?
Just give us a second. They'll be coming right back on, I'm sure.
Oh, no problem. So the purpose of the registry is to rapidly define the impact of coronavirus on inflammatory bowel disease, and specifically to define how factors such as medications and different IBD treatments and age impact coronavirus outcomes for our IBD population. And we are committed to providing regular updates 3 times per week to the IBD community regarding the number of reported cases and outcomes, including data broken down by geographic region and by IBD treatment. Next slide. So the project is really composed of 2 different parts. First is our database, and the database is composed of web-based surveys that are filled out by IBD healthcare providers. And these surveys collect information on patient location, demographics, IBD characteristics, and coronavirus outcomes. All of the data that we collect is collected to a secure encrypted server at the University of North Carolina, and all data is de-identified in accordance with the HIPAA Safe Harbor standards. And on the right of the slide, you can see a survey or a case report form that an IBD healthcare provider would encounter when reporting a case. Next slide. The other major component of this project is our website. And when you go on our website, www.covidibd.org, you first encounter our landing page. And this provides more information about the project and our goals, and also offers a space for frequently asked questions. And this is where IBD providers can report a case of coronavirus in their IBD patients. And this is also where patients and providers can access the data. Our online format really facilitates the rapid sharing of data. And the website also provides links to patient and provider resources. And this is where we acknowledge our many partnering organizations.
Dr. Kappelman, do you have anything to add to what Dr. Brenner just shared?
I would like to really especially thank our many partnering organizations, both the Crohn's and Colitis Foundation and the North American Pediatric GI Society in the US, as well as other national and regional organizations throughout the world who really have helped us get the word out about this registry and have spread the word so that we're able to learn as quickly as possible.
Well, I know there's a lot of interest from the patient community, and we appreciate you doing this research. So that brings me to my next question is, how are you getting the word out about the registry?
Yeah, so we are excited to engage the international pediatric and adult GI community. And if we could switch to the next slide. So the success of this entire project really depends on broad participation, and truly we are all in this together. So we have been able to utilize the many partnering organizations that Mike had mentioned and get the word out through their professional listservs and through their websites. We've also been using social media platforms such as Facebook and Twitter. And then also patient awareness organizations throughout the world have been really vital to this effort.
So why is the registry important to the IBD community? What's the value to our IBD patients?
Yeah, next slide, please. So right now, the impact of coronavirus on patients with IBD is largely unknown. And we hope that this registry will help to answer important questions about coronavirus risk for patients with IBD, and particularly regarding IBD medications and medicines that can suppress the immune system's response, and different characteristics associated with IBD. And our unique online format allows for rapid and free data sharing. So as soon as we are getting this information, we're able to disseminate it to the public.
Dr. Kappelman, yeah, please go ahead.
I just was going to interject that I've been doing research in inflammatory bowel disease for the last 20 years, much of which has been in collaboration with the Crohn's and Colitis Foundation or funded by the foundation. And with every other research project I've done, it's always with the potential to find better treatments or find cures for tomorrow. And this is the one research project that I've been involved with over my career where the goal is to find an answer today, because tomorrow is really too late. And if you all stay on the call for a little bit longer, we'll share some of those answers that we've already learned just in the last couple of weeks.
Thank you, Dr. Kappelman. So I do understand that the SECURE-IBD Registry collects data from around the world. Can you speak a little bit more about the reach of the project and who's using the data and the website?
Yeah, next slide, please. So the response from the international IBD community really has been nothing short of extraordinary. So since we launched the website on March 13th, we have had over 60,000 individuals access the website from 139 different countries. And from the slide, you can see a world map with all of the blue areas representing places where people have accessed the website from, where our users of the website are coming from. So you can see it's really had a global reach so far.
Very impressive. Dr. Kappelman, do you have anything to add?
Just that I didn't know there were 139 different countries before starting this project.
So how many cases have been entered to date, and where are the cases coming from primarily, Dr. Brenner?
Next slide. So as of today, we have had 525 cases reported to the registry from 34 different countries. And of those cases, the median age is 41, 53% of them have been male, and most cases have been reported regarding patients with disease in remission at 59%. 19% of reported cases have had mild disease, and 20% have had moderate or severe disease, with 2% having unknown IBD activity.
Interesting. Dr. Kappelman, anything to add to this slide?
It really is a astonishing number of reported cases for such a short period of time. And I know that Dr. Brenner will take us through some of the study timeline in a little bit. But I do want to underscore that in order to learn as much as possible and as quickly as possible, we need robust participation from the entire worldwide IBD community, and it looks like we are getting just that. So I'm pleased that that we're collecting such robust data so quickly.
Well, and I understand there's a map that visually demonstrates the impact of COVID-19 on the IBD community. Would you be able to show the map, what it looks like for us, and do patients have access to this information?
Yeah, so on our next slide, you can see a picture of the map. So this is really the newest and coolest feature of our website. And yes, the map is freely available to anyone who clicks on the website, and you go to the current data tab, and then one of the sub-tabs links you right to this map. So it was developed by Dr. Gil Kaplan, Dr. Richard Geary, and Dr. Sue Ung with funding from the International Organization for the Study of IBD. And what it does is it provides a visual representation of all of our data. So as soon as we are updating our data on the website and updating our data tables, Dr. Kaplan's team is updating the map. So it allows you to see visually where our cases are coming from with the interactive world map. And then it also shows how the cases are distributed by factors such as age and type of disease and IBD medication. And if you look at the next slide, this shows the cases by country with all of the 34 countries listed on the bottom x-axis there. And you can see that right now, most of our cases are being reported from the United States, Spain, France, and Italy. Next slide. And the map page also shows the cases reported over time. And along the bottom axis shows days starting from the beginning of the website when we launched on March 13th to today. And the dark orange is Crohn's disease, and the more yellow is ulcerative colitis. And you can see the reported cases have climbed over time. And now we have about 58% of the cases reported are Crohn's disease, and approximately 40% are ulcerative colitis. The rest are IBD undefined. And you can really see the increase over time.
It's incredible that you're able to have so much data displayed in real time. Dr. Kappelman, do you have anything else to add?
I do. You know, one of the requests that we have for healthcare providers who are making reports is not to file the report as soon as COVID is diagnosed, but to wait a week or two and see how that patient does as a result of the COVID diagnosis. Usually, as everyone on the call knows, COVID becomes sort of increasingly worse over the first week or so, and then kind of plateaus and generally, for the most part, recovers. And so our reporting, you know, is intentionally lagging behind diagnosis by about a week or two. And so we have not yet had a peaking of the curve for our reporting. That's not necessarily a bad thing. I know that in the United States and elsewhere, we think we've seen a peak and may actually be turning the corner. We expect that our data will lag behind the true peak by about a week or two. So, so what we're seeing here is very consistent in IBD patients with what is being reported elsewhere in terms of, I think we probably are reaching a peak.
Thank you. So what are we learning from the data so far? And I know this is a really difficult thing to address, but could you also share any information about IBD deaths from COVID-19?
Yeah, next slide, please. So right now, it's still early to draw strong conclusions, but overall, the trends that we're seeing are consistent with the trends that organizations such as the World Health Organization have been seeing in the general population. So this is a chart showing coronavirus outcomes by age. And if you look at the rightmost column, that is what we're calling severe coronavirus disease. And that includes individuals we put in that category if they had a stay in the intensive care unit, if they required a ventilator, or if they passed away. And you can see this is divided by age group, and with increasing age group, we are seeing higher percentages of cases in that severe category. This is similar for the deaths. If you go to the next slide, this is another way of showing the outcomes by age. And the deaths are shown in the red bar graphs, and you can see with increasing age, we are seeing an increasing number of deaths, and that's consistent with what the World Health Organization has been reporting for the general population. Next slide. We have also been looking at outcomes by comorbidities, and comorbidities are other health problems. So that includes things like diabetes or high blood pressure or liver disease. And we ask healthcare providers to report on the number of comorbidities that their patient had beyond IBD. And we are seeing that individuals with higher number of comorbidities are more likely to have both severe coronavirus outcomes and a higher portion of individuals with more comorbidities are passing away. So you can see that in the second from the right hand column.
Dr. Kappelman, are there any other points you'd like to make as it relates to the outcomes you've been seeing so far?
Yeah, I think a few points worth underscoring. The first is that although this database is becoming quite large and is definitely geographically diverse, it's not a complete capture of all inflammatory bowel disease patients worldwide who develop COVID. But with that sort of caveat in mind, the overall sort of rate of mortality that has been reported in cases thus far is about 3%. And so this is roughly of the same order of magnitude as that which is being reported by the World Health Organization, the CDC in the United States in terms of the general population. And so, it really doesn't look like as a whole, patients with inflammatory bowel disease are grossly at much higher risk. And I think the other point that I'd like to underscore is, as a pediatric gastroenterologist, it seems like when COVID is occurring in younger patients, the outcomes are quite good. We've had no deaths reported to us in persons less than 30 years of age. And almost all of the pediatric cases that have been reported to us have been treated as a outpatient only without requiring hospitalization.
I appreciate all those points that you've been making, and I think it's reassuring to our community to hear this data and hear what your impressions are so far with the data that's become available. So thank you for sharing that. I also was wondering if you've learned anything about IBD medications and COVID-19.
Yeah. So again, it's still too early to draw strong conclusions, and it's very important to account for the many factors that impact coronavirus outcomes. But so far, what we are seeing is that more severe coronavirus outcomes are associated with the use of oral steroids, such as prednisone or prednisolone, and that TNF antagonist medications, so that includes infliximab or Remicade and adalimumab or Humira, do not appear to be associated with more severe coronavirus outcomes. And we really need more data to detect any trends with other types of IBD medications. But as we get that data, we'll be updating the website and the public.
And we look forward to sharing more data with our community as it becomes available. Dr. Kappelman, anything you'd like to add?
Other than we're happy to come back in a couple of weeks when we have more data and are able to draw stronger conclusions.
Great, thank you. We'll make sure that happens. Dr. Brenner, do similar registries exist in diseases other than IBD?
Yes, so if you flip to the next slide, we have either reached out to or been approached by researchers from a variety of other disease groups who have been interested in using the SECURE-IBD database as a blueprint to create an identical registry in other conditions. And this includes diseases such as cirrhosis and liver transplant, celiac disease, psoriasis, juvenile idiopathic arthritis, rheumatoid arthritis, lupus, sickle cell disease, and multiple blood cancers. So if anyone in the audience knows anyone who has any of these diseases, then they may be able to find a registry that could be helpful in informing their care. They could talk to their healthcare provider about.
And I think that's such great information to share because when a community comes together, we move the needle so much more quickly. And so I appreciate you sharing these other registries that are available. I also was wondering if you could help our audience understand what IBD patients can do to help with this effort.
Yes. Next slide, please. So there are many things that patients can do. First and foremost, please tell your IBD healthcare provider if you have any symptoms of coronavirus. That includes fever, shortness of breath, or cough, and in some cases, diarrhea. And we also encourage patients to encourage your provider to report cases of coronavirus in their patients to our website. Again, that's covidibd.org. And also, patients can participate in IBD Partners, which is a really cool patient-powered research network that they can sign up for by visiting www.ibdpartners.org. And for anyone who's already a part of IBD Partners or who signs up in the next few weeks, they will be invited to complete a patient experiences survey about coronavirus that will further help to inform our understanding of this disease in the setting of the pandemic.
Thank you, Dr. Brenner. Dr. Kappelman, do you have anything you'd like to add?
I just want to underscore the importance of the IBD Partners coronavirus study that really will be in parallel to SECURE-IBD. The ability of doing direct to patient studies is so important because only patients and caregivers can report the full experience and impact that this entire pandemic has had on patients living with these conditions. And it's more than just did you develop COVID and what happened? But, the entire world is very different now than it was 4 or 6 weeks ago. The entire field of medicine is different now than it was 4 to 6 weeks ago, as we've closed all of our outpatient clinics and have switched everything to telemedicine. Even the process of getting groceries or medications is different now than it was 4 to 6 weeks ago, and it's a really stressful time. And as a direct-to-patient study, like we were able to do with the IBD Partners Project, we're able to get at this broader impact of the COVID pandemic on the lives of patients living with these conditions.
Thank you. So I know you mentioned there were a number of partners involved in the SECURE-IBD Registry. Dr. Brenner, would you share the partners on this project with our audience this evening?
Yes, and if you flip to the next slide, we have shared some of them on this slide. So, of course, the Crohn's and Colitis Foundation, thank you. The North American Society for Pediatric Gastroenterology, Hepatology, and Nutrition, or NASPGHAN. The International Organization for the Study of IBD, or IOIBD. The European Crohn's and Colitis Organization, the Asian Organization for Crohn's and Colitis, and the Pan-American Crohn's and Colitis Organization, or PANCO. And there are many more local and regional organizations who have partnered with us, and a full listing is available on our website under the Our Partners tab. So thank you.
Well, and I thank you for sharing all of the partners, because I think it demonstrates the importance of this effort to all the IBD organizations worldwide, and we appreciate the work that you're doing. I'd like to bring Dr. Kappelman back on the screen now and just thank our speakers, Dr. Brenner and Dr. Kappelman, for joining us this evening. We are definitely going to share more data and make sure our inflammatory bowel disease community is kept up to date on the great research that you're doing. And I'd also just like to thank our audience for joining us this evening. I know there are a number of questions going on in the feed, and I want to encourage you, if there was a question that you didn't get answered this evening, please visit our IBD Help Center at 888-694-8872, extension 8, or you can email at info@crohnscolitisfoundation.org. And you can reach us also by chat. We're available by Monday, Tuesdays, and Thursdays from 9 to 5 on Answer Chat. And if we, the specialists at the IBD Help Center will direct you to all these different resources. And we also can reach out to the many volunteer physicians that we have working with the foundations, like Dr. Kappelman, like Dr. Brenner. If there's a very specific question that hasn't been answered this evening, we will make sure through the IBD Help Center that we get you the resources and the information you need. Also, if you have questions about COVID-19 that maybe weren't addressed on this evening's call, please visit the foundation website at crohnscolitisfoundation.org. At the very top of the webpage, you will see a link to all the COVID-19 resources, and they include a variety of information, from information on the medications, resources on surgery. We'll soon be adding information on infusions and ostomies. And so we're constantly updating the resources on this site, and we also link out directly to the SECURE-IBD Registry. So if you want to look at the map and delve into the data a little bit more, please go directly to our website and you can link right out to it. And lastly, I want to thank everybody for joining us this evening. If you've enjoyed this session and learned valuable information, I hope that you'll share this recording, which will be posted on our website once again tomorrow morning. And make sure you share this with your friends and family so that they can learn about the SECURE-IBD Registry and also all the other resources that are available related to COVID-19. And we really want to continue to serve the IBD community with programs like this and all of the critical education and support programs that we traditionally do at the foundation. And as everybody on tonight's call knows, our world has changed, and it's a very challenging time for nonprofits. And we are in that same situation. So if you are able and are able to donate and support the work of the Crohn's and Colitis Foundation, again, please visit our website. There's a Donate Now button, and your contribution will help us to continue to bring programs like this and others to you and provide the support needed to the IBD community. So thank you, Dr. Brenner and Dr. Kappelman, for joining us tonight. Thank you to everybody for being on our Facebook Live, and have a good evening.